And we will proceed to the clinical cases. Clinical cases, and then here radiology. Okay, 2 kidney cases and 1 home cardiology case with ECG. What was your home? You were given information about pacemakers for homework. Okay. Kidney disease. Here is your home case, and if you, as you may have noticed, it is not related with the Streptococcus infection. As in our previous lesson about the irritable bowel syndrome, where the patient in fact has a tumor. You see a very young male, a military officer, who presents with headache, face edema for 1 week. And yesterday he have noticed brownish discoloration of the urine. At this stage, when you have discovered headache, face edema, and urine discoloration, you may suspect any kind of the glomerular disease. Urine changes and edema is enough for to suspect the kidney problem. As for headache, in previous years it was thought that headache is caused by the elevated blood pressure. However, now it is widely accepted that headache is not related with the blood pressure elevation, except the cases of hypertensive emergency. Four weeks ago, patient was immunized against tropical diseases. Every vaccine, every immunization has a risk factor for autoimmune process development, because every vaccine stimulates the immunity. That's why we exert caution during immunization of patients with autoimmune disease, because we may induce the exacerbation. Kidney problem, risk factor of autoimmune immune complex disease, similar to the post-streptococcus mechanism, but the trigger factor will be the part of pathogens in the vaccine. The body is secreting antibodies to this pathogen, and these antibodies may cross-react the normal tissue, or they may form the immune complexes that will damage the kidneys. You perform the physical examination, and you see the periorbital edema, that is rather typical for the kidney edema. mild leg edema, mild tachycardia, and elevated blood pressure, not very severe, the second degree of the hypertension. But of course, this is enough to detect the hypertension. Signs: edema, hypertension, history of vaccination, strongly suggests the kidney glomerular disease. In the urinalysis, we see normal specific gravity, moderate proteinuria, erythrocytes, casts. So these are the signs of the nephritic syndrome and the signs of glomerular damage. So the most probable diagnosis will include post-immunization glomerular nephritis, so history of vaccination, signs of nephritic syndrome, and signs of glomerular damage in the urinalysis. What additional tests? We have said that the only definitive methods to differentiate between different types of glomerulonephritis is biopsy. Do you want to perform biopsy in this patient? Is it needed or no? Will it influence your therapy or no? How do you think?
I think no.
No. Who wants to perform a biopsy?
I think yes.
Yes. One of you wants and one of you do not. There is no clear answer to this question, as in all medicine. We see that there are no obvious contraindication in these patients, no uncontrolled severe hypertension, no bleeding disorders. So this decision should be made, shared with patient. You may perform biopsy at this stage, and then you may start the treatment. Or no, you may first start the treatment, and if it is ineffective, you may perform the biopsy. There is no firm guidelines in this moment because all the cases are different and should be treated individually. So both of you are right. The one doctor who wants to perform a biopsy and the second doctor who do not want to perform a biopsy. And the both ways are